Good morning, friends. I'm Dr. Pankaj Maheshwari, Senior Consultant and Chief of Urology at Fortis Hospital, Mulund. Enbloc excision of superficial bladder cancers by holmium laser, a feasibility study conducted at Fortis Hospital, Mulund, Mumbai, India. Bladder tumors is a common clinical problem. Superficial bladder cancers are usually treated by transurethral resection of bladder tumors by electrocautery. En-bloc resection of bladder tumors is an emerging technique aimed at improving the quality of surgical specimen. Available evidence suggests it to be safe while giving oncological equivalence when compared to TUR-BT. We aimed this study to find whether holmium laser could be used for en-bloc excision of superficial tumors. Is this procedure safe, and do we get adequate sample by this technique? 40 consecutive patients presenting with a preoperative diagnosis of superficial bladder tumor were included in the study. Transurethral en-bloc excision was achieved with a small mucosal margin by a holmium laser at an energy of 1.5 to 2 joules and a frequency of 40 to 50 Hz. Base biopsy was taken by holmium laser or by punch biopsy forceps. Staging quality was measured by presence of detrusor muscle in the pathology specimen. Various other perioperative parameters like bleeding and need for transfusion were also analyzed. Standard transurethral holmium laser prostatectomy instruments were used. A 100-watt holmium laser equipment was available. Punch biopsy forceps to take base biopsy and random biopsies, and bladder evacuators and morcellator to evacuate the tumor from the bladder. This sentinel case is a 72-year-old gentleman who presented with painless total hematuria and had a 3 centimeter papillary tumor near the left ureteric orifice. As a standard protocol, the first step of any bladder tumor excision is a thorough bimanual examination and cystoscopic examination. Blue light cystoscopy was done to confirm that this was the only tumor and there were no secondary tumors all over the bladder. While doing holmium laser excision of bladder tumor, it is important to get under the tumor and identify the stalk. To get under the tumor, the resectoscope beak was used to push the tumor away. The irrigation pressure of the irrigant fluid also helped in pushing the tumor away. Once under the tumor, the stalk was excised with couple of millimeter mucosal margin by holmium laser. Holmium laser was first used to mark the site of incision, and then gradually this incision was deepened till the tumor was completely excised. All bleeding vessels entering the stalk are coagulated by holmium laser. Any major bleeder could be coagulated by a defocused holmium laser beam. Here we can see, due to the precise cutting of holmium laser, the final few connections of the tumor are being severed from the bladder mucosa. The procedure appears nearly bloodless in view of the brilliant hemostasis with holmium laser. Complete tumor was removed and a good bladder-based biopsy could be achieved. This was a very interesting young child who presented with chronic constipation to his pediatrician, and during routine evaluation was found to have a 15 by 18 millimeter tumor near the left ureteric orifice. Through a 18 French cystoscopy sheath, a 550 micron laser fiber was inserted through stabilized in a ureteric catheter. Complete excision of this tumor was achieved with holmium laser. Interestingly for this child, the histopathology turned out to be chronic cystitis. This case is shown just to show that after ablating the base of the tumor, it is possible to identify the muscle fibers very well at the base of tumor. Once muscle fibers are identified, taking punch biopsy from these area would definitely give a good muscle tissue in the histopathology examination. Brilliant hemostasis can be achieved during this procedure. A flexible punch biopsy forceps is being used to take deep muscle biopsy. Another elderly gentleman presented with significant hematuria over 3 months and was found to have a very fiery looking tumor very near the right ureteric orifice. This tumor was extremely vascular and would bleed at touch. It was possible to properly excise this tumor by holmium laser. As the tumor was very near the ureteric orifice, it was important to take precaution not to injure the orifice by holmium laser. At the end of procedure, that's the ureteric orifice which has not been injured. Now the tumor-based biopsy is being taken by holmium laser. Here the area where you want to take tumor-based biopsy is being marked by holmium laser, and once marked, this area is deepened till you get a good biopsy specimen. Another young man presented with a huge bladder tumor, nearly 9 centimeter tumor filling half of the bladder. When we looked at these images in details, it was identified that the stalk of this tumor was very short and probably it would be possible to completely en-bloc excise this tumor. It was possible to do this. The procedure took nearly 60 minutes. The tumor was removed from the bladder by morcellation, and the morcellated weight of tumor was nearly 170 grams. Most of the patients were in the third and fourth decade. The tumor size ranged from 1.5 to 9 centimeters. 18 patients had a single tumor, while 22 had multiple tumors. En-bloc excision succeeded in all the patients. The median operating time was very short, around 20 minutes. Three-way catheter was kept in 16 patients, that too for less than a day in most of these patients. At 4 hours, nearly 35 patients had very clear urine. Catheterization time was short and patients were discharged in 2 to 3 days. Detrusor muscle was identified in 37 out of these 40 patients. None of the patients needed switch to conventional TUR-BT. Overall, there were hardly any complications, no transfusions, no obturator spasms, no bladder perforations. Literature shows that when TURP is compared to en-bloc resection, both are comparable. En-bloc resection is safe and effective. Recurrence rate probably could be less in patients with en-bloc resection. Detrusor muscle was identified in 100% patients of en-bloc resection group, while only 70% of TUR-BT group. Another recent review has shown that detrusor muscle identification is a major advantage with en-bloc resection. Most of the energy sources can be used for en-bloc resection. Holmium laser has an advantage of precise cut and hemostasis. To conclude, en-bloc resection of bladder tumor is a promising alternative to conventional transvaginal resection of bladder tumor. It is safe in patients. Thank you for a patient hearing.